So, what sort of questions have I puzzled with over the years in trying to understand and do better care for my patients? What are the concepts involved in ethical healthcare? How do we attempt to be ethical? What does it mean? Who can help us? Surely all the decisions I make and my family makes are ethical. I suppose the bottom line is, how do I know I've contributed to the best decision for my patient? Sometimes patients get better and we discharge them. Sometimes they don't get better and they discharge themselves. Sometimes they're going to die. But I think if we know that we've contributed as well as we can to make their lives better and to help them make the decisions, we should be able to sleep easier at night. The times that I most worry is when there could have been several possible outcomes to a decision and I don't know if I helped make the right one. Who can help me develop those skills? And rather than leave it to develop over several years and by luck in the field, I would like to contribute to getting this knowledge out there earlier in people's careers, but I think it helps us all to have these discussions at whatever point we are. And to help particularly novice clinicians understand that there is not a treatment recipe book, which is kind of how we're encouraged to think at school. I just like this picture. It's quite a fun thing if you go to the Merriam-Webster dictionary site and they have a visual thesaurus. And the point here is that values, these personal things, have many, many connections. They have many words associated with them. They're quite nebulous. Morals, slightly less so. We're kind of coming down to a few bigger principles for a society. And ethics, as you can see, are value systems or ethical codes. So my personal values are going to be highly unique to me and they're going to cover all sorts of issues, whereas the code of ethics for the American Speech, Language and Hearing Association or the Royal College of Speech Language Therapists in Britain is going to be much more clearly defined. So all three are related to a degree and I think people colloquially mix up the words ethics and morals and values, but I think we need to separate them out so that if I'm having problems with a patient or a family or a decision, is it because of my personal value system or is it something that's transgressing my professional ethical code? And I think we need to be quite aware of the difference in those things and understand how those things affect our clinical care. I suppose for me this is the absolute fundamental thing. I have to respect another's worth, that is, I have to respect another person just because they're another human being. And they have a right to make choices about their life and specifically about healthcare. And interestingly, the laws around informed consent actually come back, I think, to the laws around trespass and to not being able to trespass on someone's estate. And we have sort of a close alignment here with trespassing and battery. If you do a test on someone and they haven't given you permission, that's actually legally prosecutable as battery. But this autonomy thing is curious, and we're going to keep coming back to it during the webinar. So how would that affect us? We have to accept that a patient may choose not to have aggressive health intervention. They are not going to take up chemotherapy. They are not going to have surgery for that leg. They are not going to have speech-language pathology. Thank you very much. I know you think I need it, but I don't want it. So, for example, might have, say, a grandfather who definitely has risks of choking on things like solid food, meat, potatoes, things like that. But in his family, the big social occasion of the week is when the grandchildren come over on a Friday night and they go out, they play in the garden, they play baseball or they play football, and they have hot dogs. And this is a nightmare scenario for us being involved in dysphagia because they're talking and laughing. We know this gentleman has a risk of choking, but he wants to eat the hot dogs. But the important thing for that man is the time with his grandchildren. And eating the hot dogs is an inherent part of that experience for him. And we need to work with that man to help him minimize the possible costs. Clearly, choking on a large piece of hot dog is not going to be good. Balancing that against the benefits of this shared experience with his grandchildren. So this is why we have to respect a person's autonomy.